Spot. Hello, everyone.
Hello.
Welcome to India virtually.
Thank you. Thank you guys so much for having us on.
So now we are going to have a session on American Diabetes Society, ADS. So they are the office bearers of ADS, and which is an alternative to American Diabetes Association. So I'll just come to that. I'll just finish the introduction first. A quick introduction of the session. Uh, for new viewers, I'm Shashi, a certified metabolic health coach from D-Life, India's first and only award-winning low-carb platform, founded by Anup Singh in 2014, who is an IIT engineer. So D-Life pioneered the low-carb movement in India with Anup's groundbreaking 100 grams of carbs per day. This protocol made it very easy for India to adopt low carb, especially for diabetes and various other metabolic disorders, especially for the vegetarians. So in 2020, he also launched the diploma course in low carb nutrition, which is government approved. And also it has 144 CPD hours, probably the largest one in the globally. And of course, me and Anup, both of us organized the historic first metabolic health conference, low carb conference in 2023, second one in 2024, and this is 2025. So this is just introduction. And now about the session. I'll first introduce about the American Diabetes Society. So an alternate society which is dedicated to reshaping diabetes care through evidence-based lifestyle first approach. Instead of the pill based, it is lifestyle first approach. Unlike the conventional organization, ADS challenges the outdated dietary guideline and emphasizes the role of therapeutic carbohydrate restriction and real food intervention in diabetes management. I think is very much needed in today's world. And their mission is to empower the patients and the practitioners with science-backed strategies to put diabetes into remission. So we have the office bearers with us, Dr. Tony Hampton, a board certified family physician and obesity medicine specialist. He is a strong proponent of metabolic health intervention through diet and lifestyle. With a focus on low carb and keto nutrition, he actively educates patients, healthcare professionals on the importance of addressing insulin resistance, obesity, diabetes using sustainable real food solution. He is also author and also a podcast host. So he has his own podcast channel also. And Michelle Hurn is a registered dietitian, an RD, and an endurance athlete, and is known for her groundbreaking work in advocating low carb and animal-based nutrition for optimal health. Having personally overcome severe health struggles, she is now educating others on the flaws of conventional dietary advice and highlights the power of nutrient-dense whole food for preventing and managing chronic disease. Of course, she is also an author and may have written one or two. I think I know for one that you have written one book, and I don't know, you may have few more other books also. So welcome to India. Welcome to
Welcome.
Metabolic Health Conference channel.
Thank
Anup?
you. Thank you guys for doing this.
Thank you, guys. Happy to be here.
So I'll shoot the first question. What we are going to do is we are going to discuss about the ADS, and we'll also discuss about both of you in short. So the good work you do. So what was the need for the formation of this organization, which is an alternative to the big organization we know? Who floated the idea, and what are the gaps you want to fill in? Who can answer that?
Well, I'll start and then I'll tee it up to Michelle a little bit too. So the American Diabetes Society is a way to think about diabetes a little differently. In this clinical practice where I'm at right now, I'm literally between patients during this meeting, which, I do it for you guys anytime. But we're shifting from a model where we're managing disease, you can call it sick care, to a model of disease reversal and prevention. In fact, on the south side of Chicago, we're going to be spending $1 billion to build a new hospital and clinics that are designed to keep people out of the hospital. Who builds a hospital to keep people out of the hospital? That's what we're going to do. We really believe in that model. So we do respect that the American Diabetes Association plays an important role. They've been out here educating for years and years. But they're guided by guidelines that are outdated, and they have a little bit of a medication first model, and they also tend to have a lot of sponsorship from industry. And no matter how you look at it, that's going to impact your ability to give great information. So we're just here to kind of fill the gap. We're going to use science-backed nutrition facts. That's why we have nutritionists like Michelle Hurns and others who are going to help us. And maybe Michelle can talk a little bit about how it all started, who started this, who had that conversation in the beginning.
Yeah, thank you, Dr. Hampton. And so, yeah, Dr. Ken Berry reached out to me and said, "Do you want to help change the face of diabetes?" And I said, "Absolutely." So it was him and Dr. Ben Bickman. And, what we've seen, the American Diabetes Association, well, first of all, what we've seen, here in the US and certainly in India is we've seen diabetes increase, and not just like slightly increase over the years. We're seeing it increase at an exponential rate. And, I started my career as a traditional dietitian practicing in acute care. And I was told like diabetes it just gets worse. People don't get better. And that's kind of what I saw. People would come in with elevated blood glucose. Then pretty soon, they were having an amputation, there were infections, heart disease, kidney failure. And we were just taught that, hey, we just got to, quote unquote, do the best they can, prescribe the standard American guidelines, have them eating carbohydrates consistently. And it wasn't working. And once I was introduced to low carbohydrate nutrition, I saw people heal incredibly quickly. It was almost like, to me, I was blown away. I mean, I had patients who had type 2 diabetes for decades. And I was seeing people within, Dr. Eric Westman, who's also on the American Diabetes Society, posted a study that they got somebody off 150 units of insulin in 8 days. A woman I've worked with for 2 months, her blood sugars were in the 440s. I apologize. I don't know how to, if you guys do a different, incredibly high, A1C over 14. And within 2 months, she was on 200 units of insulin. She was so insulin resistant, but nobody had educated her. Nobody had said, we have to get these carbohydrates out of her diet. She was just bounced from clinic to clinic, and they kept giving her more meds. And this particular person, was low income, working 2 jobs, and just nobody said like, hey, this is an option. This can actually help reverse your type 2 diabetes. And so we got her off all and I say we, I'm not the Dr. Mariella Glant, who's also in the American Diabetes Society, took her off all medications. She went on a strict 0 carb diet. And I can see her blood glucose every day. And as of today, her blood glucose is 130. And for us, like, it's still not in the, the perfect range, but we're 2 months in. And when we had a video call, you guys, she was crying. She said, I had to go, I kept testing my blood glucose thinking this is wrong. It hasn't been this low in 5 years. And so what we saw with the American Diabetes Association, just like Dr. Hampton had said, is why I think I'm sure initially they had good intentions, right? We want to educate people. We want to help people. Their slogan is connected for life. Basically, we want to help you manage this disease. We're at the American Diabetes Society. We have no interest in being connected for life. We want to get you better and want you to send you on your way and let you live a happy, healthy, diabetes-free life. And so we're using the evidence. We have overwhelming evidence that therapeutic carbohydrate restricted diets are not only safe and effective, but they're sustainable. People like eating this way because the food is delicious. It's challenging. We can talk more about this because our modern food environment is just so inundated with processed foods, and then there's terrible information out there. But, the American Diabetes Association dietitian, and her and I have had a few, we'll just call them disagreements. They say that they want 1/4 of your plate to be starchy carbohydrates. So you tell me, if you can't tolerate carbohydrates, if you have type 2 diabetes, which is a disease of carbohydrate intolerance, why should you fill your plate with 1/4 of carbohydrates? And their actual official stance on nutrition, this is my favorite part, is they don't have any stance. They say we don't recommend any diet. And the only reason you would do that is because you have corporate sponsorship that they are literally sponsored by big food companies, which we know make people sick. And they're also sponsored by companies that make insulin that are going to, keep people sick. So we decided we needed an association that took no sponsors, not like that. If we're taking a sponsor, it's going to be from someone who aligns with our mission. But it was initially, we've had 100% funding just from people who said, like, we believe in this and we want to change.
Very interesting. So you'll also be very happy to know that today is the anniversary of Anup Singh. When I say anniversary, it is not marriage anniversary. It is diabetes anniversary. He has completed 14 years of pill-free type 2 diabetes life.
Nice. That's
Just for
wonderful.
you. 14th Valentine Day. So the
I
14
love
years
it.
for him, and for me it is 9 years. I already completed more than 9 years of pill-free type 2 diabetes on a low carb nutrition, and he was on a low carb, now he's on a carnivore diet.
I love that.
Yeah, Anup.
Yeah, with this, information, I would like to come to one point that the evidence of low carb has been around for decades. Since I'm living, 14 years pill free. So I would not be wrong to say that evidence is there for more than a decade. Now, ADA, as we know, is funded by the pharma giants. And I would be very direct that their opinion is dictated by their sponsors. And as Michelle said, they don't have an opinion. So probably they don't have an opinion because they want to get more money flowing into their association. Now, given that, of course, you would be presenting them all the evidence, trying to, fight their existence, I would say. Existence in the sense because they're making people sick by just one statement. Diabetes is a progressive disease. Yes, it is progressive because you're not getting your A1C down to 5.6 and below, right? And that's only possible because of low carb, because there's no drug that can achieve it. So given this, the information that we have, do you think that there'll be a lot of pushback from ADA as you move ahead? And how do you plan to challenge their pushback, so to say, industry-funded pushback?
Yeah, I mean, there's definitely going to be pushback because the recommendations that they're making are contrary to what we're making. So how do you push back? The first part is that you need to educate the front end user, the person who's like living with this. And as many of us have discovered, for me, it was an irritable bowel, and for other people, it was weight loss or diabetes. They need to learn that there has been research that's already been done. Michelle just mentioned Dr. Eric Westman, and he's been doing research in this space since 2002. We have organizations like Virta Health, which they're also doing wonderful work showing that not only can you prevent diabetes by eating a low-carb diet, but you can also put it into remission or reverse it, depending on which language you prefer to use. So I think part of it is, by the way, the American Heart Association has a blip, they have a little blurb saying you can use low carb or keto. Oh, the American Diabetes Association already has endorsed it in spite of us being critical of them as a dietary option. We think it should be the diet, but they're considering a dietary option. Oh, by the way, the American Association of Clinical Endocrinology has endorsed it. So for clinicians out there who are a little nervous about us being on the front lines promoting this, they shouldn't be nervous because you have entities that have already shown us that it's okay to do it because they've actually put it out there. Now, for me, personally, I push back because I have a wife who has type 1 diabetes and she never had control until she was able to reduce her carbs. So I think, a continuous glucose meter will make it very clear that if you eat certain foods, it's going to negatively impact your blood sugar. So it's very frustrating to have an organization like the American Diabetes Association recommending, sometimes I see documentation where they're saying 45 carbs per meal, and if you eat that way, you'll be chasing insulin spikes all day long. So our job is to educate the public about an alternative approach, an approach where you don't have to chase insulin spikes because you're eating foods that don't spike you. If I eat an egg omelet in the morning, I'm not going to have to chase a spike. If I eat grits or oatmeal or toast, I'm going to have to chase a spike. So it's not logical to then say to a person, it's okay to eat those things that spike you, just take more medicine. It doesn't make sense. So how about if we don't eat the stuff that spikes us and take less medicine? That's a better model, not only for the patient, but for the entire health system and any country, whether it's India or the United States. We all are needing to reduce the cost of care. And so everybody wins with this model. There will always be people who need insulin. There will always be people who may have to take some medicine as bridge therapy. But to suggest that that's the outcome that we all have to live with, which is chronic disease management with medicine, is just the wrong message.
Yeah.
So, yeah. Please.
Oh, I was just going to say, I agree 1,000%. And coming from the, dietitian side, unfortunately, the education for dietitians is heavily sponsored by processed foods as well. And so most dietitians, when I worked in acute care setting for type 2 diabetics, 45 grams of carbs a meal was rare. I mean, it was up to 90. Some of my patients had 120 grams of carbohydrates per meal. This is for type 2 diabetes. And there's just such there's a lot of fear mongering in the dietitian world. People are still afraid of the low carbohydrate diets. They're afraid of saturated fats. They believe that you have to have carbohydrates, regardless of the disease state, whether it's obesity, kidney failure, type 2 diabetes. And so I get that a lot. I get dietitians messaging me saying, I'm promoting a dangerous diet. And I think, like you gentlemen said, I think the best thing we can do is come back to the evidence. Because, I lost my health in 2019. I was a very high carbohydrate athlete and transitioned to a very low carbohydrate diet. Now I'm a very low carbohydrate athlete. And I was floored how much evidence we had. And this was in 2019. We have even more research papers published now on specifically low carbohydrate nutrition and type 2 diabetes. Like, I was literally angry. I printed out all these studies and I took them to my clinical director and said, what are we doing? Like, why don't we start doing low carbohydrate nutrition for our type 2 diabetics? And she said, oh, absolutely not. We have to prescribe the guidelines. Like, they're in many hospitals, you can still get in trouble. Like, you can't. When I was practicing up till 2020, I left the hospital setting. You could get in trouble for teaching low carbohydrate nutrition. So I do think we're going to have pushback.
Yeah.
I could understand this because I am an ex-pharma guy. So I was in pharma for 35 years in sales. So I could understand the kind of the clout we have over the guidelines and everything. So how do you plan that ADS will engage with insurance companies or various hospitals or with medical practitioner and get this awareness, try and push this? So I probably see that insurance may benefit by pushing low carb because then the expenditure will come down. How do you see all this?
Yeah, it's actually I'm one of the few people in the low carb community that's still in a conventional health system. I think about Dr. Mark Cucuzzello, who had to leave his conventional health system, and now he works for the VA, which is a little bit more open-minded. But I think, and if we were to think about the VA, let's start with governmental agencies, because I think governmental agencies and insurers are all into reducing cost of care, right? So in my large health system, we're a population health organization. So we actually are incentivized to reduce the cost of care. What better way to reduce the cost of care than to do what Dr. Mariana Glant does, or Dr. Tro, who are two physicians who have apps and other resources to support people to learn this model, but you need coaching and support. So they're doing that work. And if we reduce the cost of care, how about you pay me not just for sick care, because we do get paid more in the United States to take care of sick people, which is appropriate because it takes more resources. But should I also get paid if I have a person on insulin and all of these pills, because I took them off of all those insulins and pills? It costs about $10,000 to $15,000 per year per person to take care of a person with diabetes. How about if we eliminate that cost by reducing that? And there's probably $300 billion or so that are spent. So part of it is you convince the insurers and you convince the government, let's reduce the cost of care. The other part is what we're doing now, which is to get in front of people. And you guys are probably sipping the Kool-Aid, so this is a different audience here. But for people who are not indoctrinated in understanding these messages, the American Medical Association and all these organizations, we're going to get in front of them and offer an opportunity to teach these lessons. Let's have a metabolic session where doctors who have never heard this are going to be able to hear this. And we have leading experts who will be able to then message this. So I think that type of approach will be important, but it's also about collaboration. And what I loved about Dr. Tro, who has a metabolic clinic, is that he went to an industrial company and with others like Nick Norritz, who's a wonderful, brilliant medical student at Harvard, who also has a PhD. And they said, we will help you to heal your teammates, your employees. And in fact, they were so convinced they'd do a good job that they actually didn't charge them until they saw results, right? So imagine if we did a good job in this health system doing that work, we could then take our understanding, and we can either be a consultant, or we can just teach their teams, or we can do it for them. And now we can, butterfly effect. Now we have other health systems understanding the benefit of this model. So we need health systems to simply have a model where they're compensated to heal people. And then, because you have to incentivize people to do the right thing. And and doctors want to heal people, they just don't know how to do it. And I think that's the vision I see, and that's the vision I'm hoping for.
It is tremendous. There of billions of dollars going into medication, and everything could be just saved by changing the nutrition.
Tons.
Yeah, before I come to next question, Michelle made a very interesting statement that if you are allergic to carbohydrate, what's the point of, shifting from one type to the other? Now, as I understand, the nature of carbohydrate will only, impact the PPGE, postprandial glucose excursion. But if you're taking 100 grams of carbohydrate / glucose, I'll call it, because everything is being converted to glucose, it will need X amount of insulin, right, in a day. So day's insulin requirement is not changing. You may be, substituting potato chips with maybe, I don't know, sweet potato or something. Lot of fiber, spike will be less. But at the end of the day, insulin need is not going to change. Am I right?
Yes, 100%. And I think that's
Yes.
another thing that's kept dietitians very confused, is dietitians say, oh, well, if you have type 2 diabetes, we'll just focus on these whole grains. We'll focus on wheat bread, whole grain rice. And that's not, it would be like, if your house is on fire, maybe you're putting less gasoline on it.
Right.
Still not a good idea to put gasoline. I mean, we're still going to be causing problems and damage. Let's not put gasoline on the fire. So yes, it like you said, it doesn't matter. I think there's a big disconnect. Like, it doesn't matter if you're eating, a bowl of white rice, or a quote unquote, sweet potato, or a chocolate chip cookie, or a banana. I have a graphic that I have on my social media that shows somebody who ate a banana, because I often have type 2 diabetics tell me, oh, fruit is healthy, and their blood sugar went up to 300 within 30 minutes. When you're very insulin resistant, you cannot tolerate carbohydrates. Thus, the best way is to completely eliminate them or vastly reduce them. The dietary carbohydrate requirement is 0. So why we would tell people who are sick and can't tolerate them that they need to have them consistently and dose with medication consistently is completely ridiculous. And I also feel like there's such a misunderstanding. I worked with type 2 diabetics that would say, oh, my blood sugar's, it's managed, it's really good, and they'd be on all this insulin. It's like, if you're using insulin, your blood sugar just doesn't evaporate, it doesn't go into a magical universe. It has to go somewhere, right? Your cells are already saturated. Your liver is saturated with, glycogen and glucose. And so where's that glucose going? It's going to be stored as fat. And depending on your genetics, it might be stored as visceral fat. And that is incredibly dangerous. That's why type 2 diabetics have, a 2 to 4-fold risk of getting heart disease.
That's right. Let me say this real quick. I had a patient, this is unrelated to diabetes, but related. She came in with diverticulitis, which is inflammation of the pouches in your colon, called diverticula, which comes from inflammation. And during her healing process, they told her to go on a low-carb, low-fiber diet. This is the funny part. They said, after you heal, we then want you to go back on a high-fiber diet. Now, is there any logic? This just happened yesterday. So this is what we're faced with, and this is what we're challenged with. And I say that to say this. If you understand that the poison is excessive carbs, there's never a scenario where it makes sense to then consume carbs. Now, or you consume carbs that are not going to spike your sugar, low glycemic carbs. So it always makes more sense to eat, animal protein, non-starchy vegetables for a diabetic, because even when they put their diabetes into remission, they're still going to be more vulnerable than the person who never had diabetes in the first place. So why would we continue to challenge them with the poison that led to the problem? that's because when I got my master's in nutrition, it was clear that my professors, many of who were plant-based, they just had this fear of keto. They had this fear of low carb. They just couldn't let it go. And they were so afraid of saturated fat. They were so afraid of the risk for cancer. All this stuff's been debunked. And I just understand. And I just got my master's a few years ago. So we're still teaching the new nutrition professionals like Michelle the wrong information. And it's almost like they have blinders on, and we are here to unblind them so that they can see and start thinking for themselves until these larger organizations and educational institutions catch up with the science.
I would like to add to that. People working from ground up model like you, Michelle, me, and all of us, I believe they have more brains than people working in all these associations, right?
I'd like to think so
And
too.
Seriously.
yes.
Yeah.
So coming back to what you mentioned, Dr. Tony, that there has been, some endorsement from various associations for low carb. Now, I would not call it, in particular, any, strong endorsement. It is just there because the social media movement has been so strong that now you cannot neglect it. So why do you think it is a half-hearted attempt still, despite, as I said in the beginning, decades of evidence being there? Why is it that they don't publish it on the front page of their pamphlet?
Yeah, there's a lot of
If I
yeah.
may intervene, I call these guidelines as a set of pamphlets,
Yeah,
flyers.
there's bias because if I have an organization that sponsors me, and it is not in my best interest to then say things that may not lend itself to that organization. So for example, everybody thinks oatmeal is health food. And if my sponsor is Quaker Oats, it's kind of hard for me to then put in front of people that that particular food item is going to be harmful. So a lot of it is even if your spirit tells you otherwise. We just had something where one of the Republican in politics, just one Republican stood out and voted against his colleagues, but he's also retiring. I mean, it's like you almost have to be walking out the door. The previous CEO of the American Diabetes Association, when she spoke publicly about the idea that she was reversing, she got off of all her medicine except for metformin, which she could have gotten off too. And she was told not to speak publicly. And until she was out of the organization, was she able to. So I think once you have these hooks in you, it's impossible to then speak truth to power. That's true in politics. That's true in the space we're living in right now. We're hoping Kennedy will at least be able to put in front of people the things that we need to start working on. And that's why people are excited about him. But we just got to remove the money out of politics, the money out of what we do when it comes to the health of the country. And until that happens, we will always be pulled in a direction that lends itself to where the money came from. So it's going to be a challenge, but I do believe that there's grassroots efforts will work. There are people in politics in America who have ran, and all their money comes from the people. And until we move to a model like that, where the money comes from the people and we don't have bias, we're going to continue to struggle because people, they have blinders on and they can't imagine raising money without industry, big pharma, et cetera, that's driving the conversation. So it's very discouraging, but I'm very optimistic that we can reach the people, and that's why we're doing this work.
So
The next part of that question is, do you think, as you move ahead and educate the concerned healthcare system that you have, from doctors, clinicians, everybody, do you think, the one big impediment would be the human nature not to agree that they were wrong? While you're teaching them the correct science, they have been practicing for 50 years and they'll say they will refuse to accept they were wrong. So how do you, plan to challenge that or correct that?
Yeah, well, yeah, the evidence, right?
Yeah.
I know in my health system, it'll be the evidence. So, and I start conversations, even if I'm on YouTube making a YouTube video, I start conversations by saying, I was there, I was right where you are. I also believed the things I believed. But one thing I learned when I was in my master's for nutrition program at the University of Western States, they taught us, we had an entire class that told us how to read research studies, right? So when I talk to clinicians, I say, honestly, I was just like you. I would listen to the headlines. I would believe and I never really, I would read the abstract. I would never ask questions like, who sponsored this? Is there, was the quality of the study done? Was it really low carb? Or was it like not really low carb when they did the study? Because everybody has their own definition. So part of it is to help my colleagues. And that's what I'm going to do in this, this $1 billion that is being given to the South Side of Chicago. They're going to have an ambulatory forward model, meaning that the ambulatory space, the clinics are going to be where the work's going to be done to keep people out of the hospital. But we're also going to have education so that clinicians like myself can get in front of my colleagues. And so they won't just be clicking a referral to go to like a metabolic clinic. It'll be helping them understand, here's what we've been taught in the past. The research has evolved, and it evolved in a way that has made us clear about what happened in the past. We now understand that Dr. Ansel Keys was wrong with his fat hypothesis and that he kind of fudged the data. We now understand that there's a difference between observational research and randomized controlled trials. One shows cause and effect, the other doesn't. And I think, and just explaining to people why we got to this point, and then showing them, look at this great research. Wouldn't it be nice to take people off to be a prescriber? So I think that once they need stories, like Michelle was very good at sharing stories. If you tell stories and anecdotal examples of what's possible, and ask people, why did you become a doctor or an advanced practice professional in the first place? And then you inspire them with your stories and you show results. And when we do our work here, we plan to connect it, just like Dr. Tro and others, with research so that we can publish stuff and say, look, guys, look what we're doing. So we can inspire other clinicians, other health systems, and hopefully the country to move this model forward. So it's going to be a lot of work, but for the same reasons that the organizations had to put a little note that low carb is okay, there's a point where the science has to be, it is what it is, and people can't keep arguing with the science. So I'm going to ask my colleagues, can you go back to being that scientist you were trained to be? Can you be skeptical, question everything, even yourself, and let's now challenge each other, but do it with respect and dignity. And when people struggle, just like in India, if you're plant-based, maybe your religion is Hindu, we have a plan. Dr. Mariana Glanz has shown us how to do that. We can do that too. So you don't have to be like a carnivore like myself. You can simply learn how to do it depending on their situation. We need to meet people where they are. And that's why when we speak to people, we think respectfully, and we use language like metabolic health. I would not start a conversation with my health system saying we need to all be carnivores. That would not work. We're trying to achieve metabolic health, and here's some ways to do it, and my expertise may help you guys get there.
Yeah, I totally agree with Dr. Hampton. There's a lot of cognitive dissonance in the dietitian world, but I do think that I've always felt like if I'm going to debate with somebody, if I'm going to talk about low carbohydrate nutrition, I'm going to talk about any nutrition topic, I need to understand their argument better than they do. And not everybody gives me that same courtesy. But like he was saying, I can say, hey, this is what I learned. I learned the high carbohydrate. I learned consistent carb and insulin. And then ask them, have you had success with that model? Have you got your patients off medication? Because I worked in a hospital setting for over a decade, and we didn't. People got sicker. But yeah, and what can we consider this? Can I show you the evidence? Can I show you these testimonies from people I'm working with? But it blows my mind. I have patients, I work with type 2 diabetes. I also work with eating disordered patients. I had a patient who had been struggling with a severe eating disorder for 17 years, hadn't got a full day without binging and purging, and did a therapeutic ketogenic diet and went for 3 months, completely symptom-free. And when she went to her doctor, so excited, just going in for a checkup, they told her, oh, that's a dangerous diet. To me, that's at some point we have to call in ethics. Like, what are you talking about? So I hear that and I feel that, but I think like Dr. Hampton was saying, as we continue just to share our stories, and we have to do it kindly and respectfully. Like if anybody spent any time on social media, even LinkedIn now, my goodness, people are sometimes not very kind. But we have to rise above. We continue always coming back to the evidence, always sharing our testimony. And I think, what I've learned being in this space is even if you don't see it right away, people may not respond or send you a message. I have people message me later that say like, God, I watched you last year and it got me thinking and I've made these changes and I can see it in my family. So as we continue to advocate, I think we're going to see the ripple effect.
I think these are all powerful stories and of real life stories, of course, and they yield results. So what are the future plans? I mean, have you chalked out certain plans for ADS, how they will go ahead? Do you have any programs, anything planned as of now?
Yeah, I
Are
think,
you going to
well,
collaborate with someone? Are you going to collaborate across the globe? How is it?
yeah, I think the main thing is when we meet, we're trying to decide who to partner with, who to collaborate with, and there's a lot of people interested in getting this message out. So I think this first year is going to be similar to what we're doing here. We're going to try to show instead of me just going to a meeting as Dr. Tony Hampton, I may go to the meeting as a representative of the American Diabetes Society. So we're trying to socialize the term and then as people, because once you gain the respect of just regular folk, particularly and our colleagues, then what happens is you'll be invited to more and more places. The good news for some of us and many of us is that we're already part of large organizations that already respect us. So we'll get a chance to, my personal goal is to go to those American Medical Association type organizations, even the College of Obesity Medicine. I'm a board certified obesity doc. Go to those places. Dr. Eric Westman, he used to be the president. So we'll go to those places and socialize this idea. Continue to develop resources. Michelle and the other dietitians are going to develop resources so that people have logical dietary things that they can share. And hopefully, whether it's a podcast or on a news station, we want to get the message out that we exist so that people have options, because they shouldn't have to go to a YouTube video I put on to learn this information. That's how good. They shouldn't have to go to a podcast. They should be able to go to their health system one day, right? And I think that the health systems like mine will engage in a conversation with American Diabetes Society. But I'll be honest, my health system, they once a new organization exists, they need to give it a little bit of a runway, just a few years to make sure it's legit. And so our job is to get out here and do the work to make sure it's legit. But I really love working with the Dr. Eric Westmans, Dr. Berries, the Michelles of the world, because all of that years of clinical experience matters. I've been in this space for 12 plus years, and hundreds and hundreds and hundreds of people have healed. So probably in the thousands. So it's been really a privilege to do that. And I'm looking forward to continuing to be in that space.
Michelle?
Yeah, I second that. So, we're new, and it's been really exciting. And, the long-term vision certainly is to continue to not just be in the US, but to be, globally talking about low carbohydrate nutrition. But initially, just like Dr. Hampton was saying, it's really credibility, and just like Dr. Hampton, if I go speak at a conference or talk on a podcast, it's not just like, oh, it's Michelle Hurn, the dietitian. It's Michelle Hurn, the dietitian representing the American Diabetes Society. And it's continuing to, get our name out there and just getting people excited. It's sad to me how many people, I don't know anybody who doesn't at least know somebody who has type 2 diabetes. If it's not themselves, it's potentially a relative or a friend. So it's getting people to really embrace the fact that this disease can be reversible with nutrition and lifestyle. And it doesn't have to be complicated. It doesn't have to be painful. It's like like I was saying with the American Diabetes Association, their slogan is connected for life. Ours is you deserve a normal A1C. Like, we want to show people, like, we're going to give you your power back. And I think there's, when you're talking with people, especially now, depression is the number one cause of disability worldwide. Like, we're living in a society that's just metabolically unhealthy and depressed. It's like the message of hope is so powerful. and the message of simplicity. Like, we're not trying to have you eat this and throw meds and do this. It's like, we're going to get it very basic. Like, I work with Dr. Mariella Glant. The people we work with, it's like no carbs, meat, fat. Like, we make it so simple, but it's so powerful.
So yeah.
Yeah,
So
Dr.
I
Tony,
think
let's come back to you. Yeah, let's talk about your book, Fix Your Diet, Fix Your Diabetes. I mean, it goes without saying it will be based on low carb diet, of course. So if if somebody has to take three important messages from that book, what would it be?
Yeah, I think when I wrote that book, and it had a lot to do with we've been through so much with the pandemic, but when you get bored, you start doing fun stuff. But the first part of the book is to talk about, your motivation and your belief systems. I believe that most people struggle because they need a little motivation to get them going. And it's our belief systems, particularly self-limiting beliefs, that will keep us from being successful. So part of it is and that's why we need coaching. That's why I think most successful, whether it's Dr. Eric Westman with Adaptive Life, most programs have coaching involved. So even Verta Health has coaching. So that's the first message from the book is let's figure out why I woke up this morning. For me, it's to be a doctor who teaches metabolic health. That's my life purpose. For some people, they want to be healed so they can actually get on the ground and play with their grandkids one day. So find your motivation. The other part is to understand the science. So the other part of the book talks about, what is diabetes? What is intermittent fasting? Why should you know? What are the things that can happen to your body because of this hyperglycemia, this hyperinsulin state leading to insulin resistance? And it can negatively, and if you could argue, the book is about diabetes, but you could argue that 70%, 80% of all chronic diseases are high insulin. So if you solve the diabetes problem, you solve damn near, excuse my French, every problem out there by simply making one change. So I really think it's important that people understand that, and fasting and low carb get the job done. And the rest of it is, the last part of the book talks about fixing your fear. We talked a little bit earlier about how saturated fat has been demonized. So I have a whole chapter talking about fixing your fear of fat, making sure they understand what low glycemic foods are. So the goal is to provide a basic foundational set of information so that people can walk away, understand what things harm them, why they shouldn't fear other things, and then just have a tool to move forward. And that was my vision. And ironically, when I first wrote the book, it was going to be a plant-based book. I changed it to a animal low-carb based book because the science supported that as the best approach. So, I'm a scientist, and I want all clinicians who may hear this or patients who see clinicians to understand, if the science says this, you should go with the science. And then you do an experiment, N of 1, to see if it impacts you the way that the science suggests it should. So that's how I would approach it.
So thank you very much. And the objective of calling ADS to this platform is also to tell India that there is an alternative platform which is coming up and which will be genuinely nutrition based and help reverse diabetes. And we too, me and Anup, we are very passionate about diabetes because we have reversed our own diabetes for many years. So thank you very much. And in future, we look forward for more such session with you. Maybe individually we'll call you again, maybe on DLIF platform or on the future conferences. So thank you very much, Dr. Tony and Michelle. Thank you very much for appearing today in this session.
Thank you. Thank you so much.
Thank you. Thank you so much for having us.
And shout out to
Thank you,
that guy
Dr.
with a similar hairstyle as me, Dr. Mr. Dyke. Just wanted to say hi to him.
Thank
Good to
you.
see
Thank
you.
you, Dr. Tony. Thank you,
Enjoy
Michelle.
your
It was
talk.
nice.
Take care.